We know that our gyms have reopened, but there may be some hesitation to go back. Well, we're going to talk to a doctor about ways to protect yourself if you want to get up and get into the gym. Okay, gyms may be opening up. Maybe you're watching from one right now, but there is some hesitation among some people to maybe get it back into their normal routine. Well, joining us now with ways to hopefully help you stay safe in the gym is cardiologist and researcher Dr. Ernst von Schwarz. Dr. Ernst, pleasure to have you with us this afternoon. So, you know, a lot of gyms, we've noticed, they are taking temperature checks, you know, when you enter the gym. But how effective are those temperature checks? Because we know sometimes, you know, people are asymptomatic or, you know, they may be just under the threshold. So how effective is that in monitoring coronavirus?
Well, you are absolutely right, Crystal, and thanks for having me on. Well, temperature checks help somewhat because if someone has an elevated temperature or fever, of course, that person shouldn't be out, shouldn't be in the gym, and should stay home and get a COVID-19 test. It's not a 100% test. There's no such thing, as you know, but it helps somewhat. There is, as you mentioned, of course, the completely asymptomatic people, and it's very difficult to filter them out.
Well, you know, we appreciate that feedback. Well, Dr. Schwarz, let's talk also about these medical grade air purifiers that a lot of people are installing now in their businesses. How effective is that?
Well, same thing. It helps somewhat, of course, but again, there is no 100% safety using any of the air purifiers. I think much more important for all of us, including your viewers, is, of course, if you go to the gym, and I think we should, I definitely want to go back to the gym, you have to keep the social distancing measures in place. You have to basically consider your own safety as well as the safety of your family members over social interests.
Yeah, it's so important. I mean, you have to be your own healthcare advocate when it comes to kind of reintroducing yourself back into these social environments. Let's talk about a lot of gyms. They are limiting class times, so they have more time to clean in between classes, and also limiting the amount of people that they have in one space. So I take it those are obviously positive steps.
Absolutely. I mean, I went to the gym actually 2 days ago and I had to sign up, and I make sure it's not overloaded. And it's a gym's responsibility, of course, to make sure that they don't gather too many people at a certain time. The gyms I talk to keep a close eye on that, and they limit it, of course, depending on the size of the gym. But again, you want to, once you are there, you want to keep a distance to the people next to you. Oftentimes the gyms have the machines next to you basically blocked so that you're not in direct contact to anyone else.
And you know, it's the issue of masks that, you know, keeps coming up. I've seen a lot of the trainers and workers all wearing masks, but part of that is you wearing a mask as well to kind of, I don't know, kind of counteract, you know, some of the transferring of the body, you know, chemicals back and or body fluids back and forth. So what about wearing a mask? I mean, it's kind of hard to wear a mask when you're working out.
Well, my take on this is you should wear a mask once you enter the gym. You should wear a mask when you move from one station or one machine to the next one. But during the actual exercise, I think it's very difficult if you do a lot of weights or do some cardio workout, you really can't wear the mask because you might not be able to breathe appropriately. So, but in between, you should wear a mask, and I'm a big proponent of that.
Okay, well, there you go. You've heard it from the doctor. Dr. Schwarz, thank you so much for those tips. Obviously, you want to keep everybody safe as we resume to some sense of normalcy. We know moving forward, things are definitely going to be a little different in terms of our day-to-day lives, but we appreciate you and your advice. You stay well.
Thank you very much.
Thank you.